Good morning, welcome. Hi, my name's Richard Amos. I'm the Chief Benefits Officer and Executive Director of the Know Your RX Coalition. And I'd like to welcome you today on behalf of HR, those of you who are here in person, and those of you who are viewing or streaming. I'd like to introduce our first speaker today. His name is Kirk Futrell. He's a wealth management advisor with CAPTRUST. He's based in Chesterton, Indiana. Today he's going to talk about solving the Social Security puzzle. In 2020, Kirk joined CAPTRUST as a financial advisor and relationship manager, responsible for researching financial strategies for private wealth clients as they work toward their retirement goals. By the way, Kirk comes here and he's on site periodically, and he has some openings Thursday. He'll mention that in a little bit more detail later. Prior to joining CAPTRUST, Kirk served as a financial advisor for Lakeside Wealth Management, a firm specializing in financial planning, fiduciary and corporate qualified plan consulting, small business services, risk and asset management, and estate tax, and life insurance planning since 2002. Prior to joining Lakeside's team, Kirk traded commodities and stock options on the trading floors at the Chicago Board of Trade and Chicago Board Options Exchange for nearly 20 years. So Kirk brings a wealth of experience and knowledge to each of us who will counsel with him individually. When he's not in the office or with a client, he enjoys being outdoors and cheering on the Kentucky Wildcats. Good for you, Kirk. Join me in welcoming Kirk for our topic this morning.
Good morning. So Richard wasn't bluffing. I am in UK is my alma mater. I graduated in '91, and I do bleed blue. So yeah, a little tough loss on Saturday, but we still have volleyball and hopefully a whole successful season of basketball, right? Okay, Richard or Coleman, maybe is this a clicker? Okay, green button, go. Okay, wonderful. So I'm a financial advisor. I work with retirement plans as well as private wealth. I got called into a meeting one time by a senior advisor at CAPTRUST. Like Richard said, I started in 2020 with CAPTRUST, but the company that I work for, CAPTRUST, was acquired, or Lakeside Wealth Management was acquired by CAPTRUST in 2020. So I still hang my hat in the same chair that I've hung it for 15 years. A senior advisor called me into their office one time and had me research a Social Security question of which I knew nothing, and all of a sudden, 20 minutes later, I was a Social Security expert. So that was about 15 years ago, and I'm still pursuing more and more knowledge along those lines. I have a booth set up over there, so I'll be here throughout this session, and then I'll stick around a little bit after. I'm on campus this week to do individual meetings. There is a couple of openings, I think 3 openings for Thursday. I'm not sure how you initially, through email, I assume, got the invitation to sign up for one of those sessions. There's still a couple left if anyone would like to do that. If not, we can set up an individual meeting later in the season or at your convenience. And then CAPTRUST at Work is a website where you can go and set up a meeting with one of our advisors really anytime you want to, from I think it's 6:30 in the morning till about 6:30 at night, 5 days a week. There's a scheduler on there. You would just put in some identifying information and then what you're concerned with to give the advisor a little bit of time to prepare. That would not be with me. It would be with another one of our advisors, but we're all good. So that's a resource available to you all. If I get away from this and start walking around, you can shoo me back over or tell me to speak up. Okay, Social Security is something that pretty much concerns everyone assuming that you're eligible, these are just some disclosures that says we don't provide tax advice, and the information that I'm presenting to you today is how we understand it to be from the Social Security Administration's website, as well as interpretations on those rules. A few things that we'll go over today is some basics, some claiming facts, some benefits by age, because those, depending upon your age, those benefits are going to vary. What happens if you want to continue to work and receive benefits? How to set up an appointment, some varied claiming strategies. I won't spend too much time on those. I don't want to exclude someone whom that doesn't apply and spend too much time on those, but we'll briefly touch on those. And then changing your mind, and then are benefits taxed and how is that determined? We'll go over that too. All right, so eligibility. If you have worked, they say 10 years, but it's really, you can break that down to 40 quarters. They do not have to be consecutive. A quarter of income, I can't remember the number exactly, it's about $1,400. So within those 3 months, if you've received $1,400 in earned income, if you've done that 40 times or 10 years, you are eligible for a benefit from the Social Security Department. The way that that's calculated, though, is your highest 35 years of earnings. You may have some earnings years where you had taken a year off for a variety of reasons. That would be entered as a zero. If you ever go back to work, then that would replace that year. So your highest 35 years of earnings is what they use to calculate your benefit. It's funded, it's 6.2, not 5.2, just so you know. So everybody puts in, individually you put in 6.2 of your income, and then your employer puts in 6.2% to equal 12.4%. And that applies, there's a concept called the earnings cap. So that 6.2 from you as well as your employer only applies to your, in 2025, $176,000 worth of earnings. After that, the 6.2 and 6.2 are not levied against your earnings. Okay, so when people think about, is Social Security going to be here? One of the tools that they have is to raise the Social Security wage base. So I've asked people, what would you do if they raised the wage base? And they look at me glossy-eyed. They're like, I don't know, I just guess I would come to work. So politically speaking, think about this, politically speaking, if they raise the wage base, that would be a way for the Social Security Department to increase revenue, thereby carrying the Social Security fund past 2034, which is where they're thinking that benefits might start to be reduced. If they don't do anything, they have a lot of tools. This is one of them, just to kind of implant some confidence in your all's mind and in mine too, because I'm not getting any younger either. So full retirement age, I wish they would get rid of that term. People have said to me, well, I can't retire till I'm 67. And I know exactly where they got that number from, because the Social Security Department has determined that that person's full retirement age is 67. That's just a term that you'll see a little bit later in my presentation that the Social Security Administration uses to calculate your benefits in a number of different ways. Okay? I wish they would rename it. One of the main reasons that people need to know their FRA as determined by the Social Security Administration is if you intend to continue to work past 67 or your FRA, full retirement age, if you continue to work and would like to draw Social Security, for the most part, that can only be done after your particular full retirement age. Okay? Everybody clear on that? If you're 62, so you can claim Social Security between 62 and 70. Any month that you defer or wait, that benefit will go up any month that you wait. Most people think, well, I know I can claim at 62, but I'm going to wait till 65. Well, you can claim at 62 and 4 months, and your benefit will actually be bigger than it would have been at 62. It's not by year. A lot of the Social Security illustrations that you'll receive will have 62 because that's the earliest. It'll have your particular full retirement age, which if you were born in 1960 or later, that's 67. It'll also illustrate your benefit amount at 70, which is the latest that you would ever want to receive benefits because it just simply doesn't grow past age 70. I think I'm getting ahead of myself. Okay. So 1960 or later, your full retirement age is 67. Very important for everybody to know their FRA as determined by Social Security. So here we go. So prior to 1954, it's 66, then it goes up every 2 months. Each year it goes up each 2 months until 1960, and then the full retirement. Your particular full retirement age is 67. That age has nothing to do with when you actually retire. I always joke that you have to play the lottery to win it, but if I played it and I hit the lottery, see you later. That day is my full retirement age. That's when I'm out of here. But as determined by the Social Security Administration, it's 67. Okay, 2 terms that are really, really important for everyone to remember. FRA, or full retirement age, we've gone over that. Okay, that is also the age in which everyone receives their primary insurance amount. So as I touched on before, the Social Security Administration calculates your benefit based on your full retirement age and your highest 35 years of earnings. What they're calculating is your PIA, primary insurance amount. What is they call it your full benefit. Please don't confuse that with your maximum benefit. Every single person in this room and everyone that's eligible for Social Security benefit, your maximum benefit will always be in an individual benefit. For your particular benefit will be at age 70. There are some claiming strategies that we're going to go over where it doesn't really pay to wait past your FRA. But primary insurance amount is what you would normally think of as my regular benefit. They reduce it down to 62 or whenever you decide to file. If you file prior to your full retirement age, that amount is calculated based on your primary insurance amount at your full retirement age. Then if you wait past that full retirement age, your benefit will grow at 8% a year. So if you wait 1 month past your full retirement age, it's 1/12 of 8%. Remember, I said your benefit goes up every month that you defer claiming. Okay? Some benefits it does not pay you to claim after your full retirement age, or 67 for most people. Any questions on PIA or FRA? Okay, at 62, which is the earliest time that you can file for a regular benefit, or several other benefits. The only exception to 62 is a widow's benefit, just so you know, widow or widower's benefit. So when I talk about your benefit and I say 62 is your earliest, that's with the exception of your widow's benefit, which we'll go over a little bit shortly. But for your benefit, 62, you will receive 70% of your full retirement age benefit, or your primary insurance amount. At your full retirement age, or 67 for most people, you will get 100% of your primary insurance amount. Then that amount grows up until your age of 70. Each month that you wait, it will go up. So at 8% a year, if your FRA is 67 and you claim it 70, 8% a year is 124% of your primary insurance amount. And that changes every year, generally goes up every year because of the cost of living adjustment. They usually release those the middle of October, so here we are in a government shutdown. They have not announced those, but they expect to announce them when everything settles down in that respect. And then there's just some examples of different benefits at different ages. This is an illustration of what we call a crossover or break-even analysis of if I file at 62 versus if you wait until 70. 82, 83 is generally where just the cumulative benefits equal out at about 82 or 83. People say, well, what if I file early and just invest it? Doesn't that make more sense? That can make a tremendous amount of sense. Although I've worked with retirees that have claimed early with that intention, and they just kind of never do that. You get a couple extra $1,000 coming in a month, and it seems that there's always something to spend that money on. But as far as cumulative benefits go, 82 to 83 is the break even for filing throughout the window of 62 to 70. Does that make sense? Gosh, I'm going to crane my neck here. Okay, can you work and claim? The answer is yes, but if you make, and for the 2025 numbers, if you make more than $23,400, they're going to adjust your benefit down. So it's a concept called deferring. I don't want to get in the weeds too much on it, but basically what they do is they defer $1 for every $2 that you make over that amount, so that you're not receiving your full your full benefit. They don't make that, when they reduce your Social Security benefit, they don't smooth it out over the year. They reduce it from the back end. So in other words, if your monthly benefit is $2,000, and throughout the course of that year you made $4,000 over the $23,400, that would mean that if they reduce your benefit by $1 for every $2 over the earnings test, they would be reducing your annual benefit by $2,000. Does that make sense? They don't divide $2,000 by 12 and reduce your monthly paycheck. You just don't get a check in December. Makes it a little bit more difficult to budget, but that's the way that they do it. Then, once you reach your full retirement age, because they did not give you a check in December, when you hit 67 or your full retirement age, they add that month in. So it grows. Remember I said 8% or 1/12 of 8% for every month you defer? They add that month back in, so you actually get a raise at your full retirement age. So you can claim prior to 67 or your full retirement age, but they're going to defer your benefit if you make over $23,400. That is only earned income. So if you retire at 62, start taking a little bit out of your retirement plan or IRA, or if you have pension money coming in, or your spouse has money coming in, that does not count against your earnings test. That will not be applied against your benefit. Collateral? You got it? Okay. The year prior to actually filing, or the year prior to your full retirement age, that earnings limit goes up. Now you can earn up to $62,160, and it doesn't affect your benefit at all. Once you reach the age of 67, you can earn as much as you want to, and Social Security does not recalculate your benefit or adjust your benefit in any way. That, in my mind, is one of the main reasons to know your full retirement age, not because it has anything to do with when you can actually retire, but as it applies to continuing to work and receiving Social Security. Widow's benefit. So if your spouse is deceased, you can receive your benefit, that widow's benefit, as early as age 60. You can choose, between 60 and 62, you don't really have a choice. You can either file, you have a choice, file or don't file. But if you file for a widow's benefit, you wouldn't be filing for your benefit because you're not eligible for a regular standard benefit until 62. You can take a widow's benefit and allow your benefit to continue to grow. That is the only benefit that is available. Prior to 2015, to the end of 2015, that was not the case. Now it is. Widow's benefit is the only benefit that you have a choice. Okay? Between 60 and 62, it's either file or don't file for your widow's benefit. Once you reach the age of 62, you can switch over to your benefit, or you can continue to let your benefit grow, which is a very, very common strategy. The widow's benefit is defined, so you'll know how much you get. If that benefit, you might want to think about if it's within your budget to claim that benefit, let yours continue to grow until your full retirement age, and then claim that. Okay? The information that I'm giving y'all is broad-based, so I strongly recommend if you're getting close to thinking about filing for Social Security, you call them and make an appointment. Different offices, so it's a federal program, so you can really meet with a Social Security Administration employee anywhere. So if you're on vacation and you want to run down to the local office, they will have, it's not a state-by-state thing. Okay, they will be able to tell you what benefits that would be available to you at different ages. Some of them allow for in-person meetings, some of them do not. Some of them will only take phone meetings, but if you do a consultation over the phone, they're very responsive, which surprises me because it's the federal government, but that is the case. They are really good about taking phone meetings. All right, spousal benefits. So this was very, very common prior to 2015 when you had the choice of filing and suspending your benefit and then deferring your benefit and then having a spouse claim a spousal benefit. Right now, once you reach the age of 62, you are what's called a deemed filer. So when you walk in and say, I want to file for spousal benefits, they basically look back at you and say, we'll tell you what you're filing for. And you have to file for all of the benefits in which you are eligible. Okay, they'll let you know that. So a spousal benefit came around from a long time ago. It was very common for one spouse to stay home and raise the kids while the other spouse worked. So now when you're thinking about your highest 35 years of earnings, you're saying, well, that only that one spouse would necessarily have substantial earnings in order to claim. So they started a spousal benefit. The way that works is the lower earning spouse or no earning spouse has a benefit based on the spouse that has a higher benefit. The maximum benefit that spouse can receive is half of the primary insurance amount of the working spouse or the higher income earner. In today's day and age, when we generally have multiple earners in a house, it's really tough to apply the spousal benefit because your maximum benefit is half of the other benefit. So if you've been working a little bit throughout your career, there's a strong chance that your benefit is going to be greater than half of their benefit. So that doesn't apply a lot of times, but it's certainly worth looking into. Make sure that you cross all your I's, cross all your T's, and dot all your I's in income planning for retirement, okay? And do that with a meeting with the Social Security Department. Okay, they'll meet with you whenever you want to, but you really don't need to to start filing or start thinking about filing or initiating that until a couple of months prior to when you plan to receive. So maximum benefit is 50%. That benefit will be reduced. Any benefit that you take prior to full retirement age will be reduced. Your benefit, a spousal benefit, a widow's benefit, a divorcee's benefit. Any benefit that you take prior to full retirement age is reduced. For a widow's benefit, divorcee's benefit, spousal benefit, any of those benefits that you receive, they do not grow past your full retirement age. Most cases 67. That's the maximum for those. Your benefit, an individual benefit, if you don't file for it, will continue to grow until the age of 70. Okay? So full retirement age benefit for widows, divorcees, and spousal, that's when those are maxed out, and your benefit is maxed out at age 70. The earnings test prior to that full retirement age applies to all of these benefits. Okay? So keep that in mind. Now you can earn a lot. I have a lot of retirees. They'll retire at 62, start receiving benefits to pay for health insurance. I know that you all have a very generous benefit for health insurance. But then Medicare, and Dan's in the back with Humana, and he can answer quite a bit of your Medicare questions. So, but anyway, after full retirement age, your benefit grows, spousal benefit does not. Divorcee's benefit. So married for 10, divorced for at least 2. If you've been married twice for 10 years, then you can actually choose which spouse you file on. Little hint, make sure it's the highest benefit. Okay? I have a note up here that your ex-spouse's benefit is not affected. I used to have a little frowny face on there, but that was kind of the antagonist in me. But that's an important thing to know. So if you file a divorcee's benefit, you filing on an ex, you're not reducing their benefit in any way. It's just based on their benefit. If your benefit is higher than half of theirs, they're not going to let you file a divorcee's benefit or a spousal benefit for that matter, because your benefit's higher. Remember, we are all now what is considered deemed filers. When we file, they're going to look at what you are eligible for, and they'll make you file for your highest benefit. A lot of times that is not a divorcee's or a spousal benefit. Divorcee or spousal benefit is only half of their primary insurance amount, and it is reduced if you file it prior to 67. Earnings test applies, always. Earnings test always applies. So 2025, it's higher than 23,400. Questions? Yes, ma'am.
I know that some of these don't decrease above the spouse primary insurance amount, but if, say your spouse, your divorced spouse, doesn't claim his until he's 70, so he has a certain amount at 70.
Good, yep.
Then, of the divorced spouse benefit and then the survivor benefit someday, are those based on him at 70 or him at full retirement age?
Good question. So a divorcee's benefit is based on your ex-spouse's full retirement age benefit or primary insurance amount, and it's half of that if you wait until your full retirement age. Okay? Your ex-spouse, if you're claiming on their benefit, they have to be 62 or eligible for a benefit. And then you can file on them. Because what they ran into is a spouse an ex-spouse would not file with the intention of not allowing the divorced spouse to file, and they got in the way of that, and so that's not fair. As far as a spousal benefit, your spouse, in order for you to receive a spousal benefit, if you haven't worked and half of your spouse's benefit is higher than your benefit, they have to be filing if you're married. They have to file in order to receive a spousal benefit. That is not the case on a divorcee's benefit, but they do have to be 62 or eligible for a benefit.
So just to clarify, so if the divorced spouse waits until age 70 to claim his, so he gets that 124% of his full retirement age benefit, then the survivor spouse benefit would be based on what he claimed at 70 or what he would have gotten at 67?
So there's no survivor spouse benefit. There's a survivor's benefit if you're married. It's not a divorcee's survivor's benefit. But we do take into consideration what's called a survivor's benefit. So if two people are married and they're both claiming Social Security, you're going to look at the amount of the check. Okay, so forget all this other stuff. You're both getting a Social Security check. When one of the spouses dies, the smaller benefit just goes away. They no longer pay that benefit to anyone. The surviving spouse receives the higher benefit. What that allows you to do as far as a claiming strategy is if you need that higher benefit for cash flow, oftentimes it would be the higher earner, but we will usually have the higher earner wait as long as they can, maybe tap some retirement assets or continue to work part-time in order to grow that benefit to as long as they can, potentially at age 70, to receive that higher cash flow. And then when one of the spouses dies, that larger cash flow, that larger benefit sticks around, smaller benefit goes away. You can't double dip, so you don't get them both. Good question. Thank you. Okay, always subject to the earnings test. I keep putting that on there. It's very important to remember. And then it's 50% if you wait till your full retirement age. It's 50% of theirs. Okay? And it's 50% of their primary insurance amount. So if their PIA, their primary insurance amount, is $4,000 and they wait until it grows to $4,500, your maximum divorcee and spousal benefit is still half of the $4,000, so that would be $2,000. Okay? If you file prior to full retirement age, your benefits are permanently reduced. So if you file a widow's benefit early because you're going to let yours grow, then when you switch over to yours, they're going to look back at when you originally filed. Then they're going to reduce your benefit back down to that age. Questions? You can change your mind, okay? So you can do it one time only. Prior to full retirement age, if you've been receiving a benefit and then you come to the Harris Ballroom and you listen to Kirk speak and you say, oh no, I should have waited. You can do over it. So you can retract your benefits. You have to pay them back. But one time within 12 months of initially filing, you get a do-over if you pay them back. Once you reach full retirement age, let's say you file now, you miss the 12-month window, you continue to receive, you're earning less than $23,400. Once you hit that full retirement age, let's say your financial situation has become significantly better for a variety of reasons, you can suspend your benefits and let them grow. You can turn them back on in a year because you just let it grow for a little while. Now your check is bigger, you turn it back on, and then another year goes by. You can suspend benefits again for a month, 6 months, 2 years, and continue to let your benefit grow. So that suspension of benefits, that's only after full retirement age, if you want that benefit to grow. But you do have the one-time do-over prior to full retirement age, or anytime if you pay that back. Good. Okay, the taxation of benefits. So originally, Social Security was not taxed. Now, benefits are taxed depending upon your filing status. So something that's important to remember, the earnings test that we talked about earlier, so if you earn up to $23,400, you can take as much as you want to out of a retirement benefit, whether it's a workplace retirement plan, an IRA, or pension money that is not earned income. When they look at how much you made in order to determine how much of your benefit's taxed, they look at provisional income. And the way to think about that is it's really all of the money that you're getting. So pension money, retirement plan distributions, IRA distributions, and then they also add in 50% of your Social Security benefit. So they look at all that, okay? They take half of what you're getting for Social Security, write that down on a piece of paper, then write down everything else you're getting, and then apply that into these windows right here. So if you're a single filer, if you're making, your provisional income, so everything coming in plus half your Social Security benefits, if that adds up to less than $25,000, you're not taxed. If that's between 25 and 34, up to 50% is taxed. Over 34,000 as a single filer, it's taxed. It's not taxed at 85%. 85% of the benefit is reported and subject to your marginal tax rate. Okay? Married filing jointly, 32,000, less than 32,000, not taxed. 32 to 44, up to 50%, and then over 44,000, 85% of your benefit will be included in taxable income for that year. We good on that? Okay. So 4 months prior to the date that you plan on receiving, you can call them up and start that process. You're going to let them know when you want to receive benefits. And then you can either file online, you can call them, or go in person. If you're just filing for your benefit, going online is pretty easy. I'm a huge fan of in-person and the telephone, because if I click the wrong button and it financially affects the rest of my life just because I misunderstood the question, that makes me very uncomfortable. So I would recommend calling the Social Security Administration. They will file while you're online. So you'll call them, they'll set up a phone appointment. Then they'll contact you on that time and date, and you can file over the phone, or you can do that in person if that office allows for that. Some of them don't. Questions? No? I think that's all that I have. Yeah. So Dan's your Medicare guy with Humana in the back, and he's gonna cover some Medicare. He's your primary source for that. But if you have any Social Security questions, yes.
Can I just confirm what you talked about earlier? So if you work and you earn over that amount, 23,400, whatever, they take away $1 for every $2 earned. So you're saying that when you reach full retirement age, or at some point you're going to get that back?
Yes. it's kind of weird the way that they do it, because they think of it as if they defer your benefit, so they call it deferral. I'm just trying to get your synapses working in the right way. So they don't take it, they defer it. In other words, you get it back. The way that you get it back, though, is you get back. So remember, this is based on the fact that the longer you wait, the bigger your benefit is. Okay? So accepting that as the truth, if you are earning over 23.4 and they defer some of your benefit, the way that they pay your benefit is by month. If you're making over that and they defer it, they're going to not give you a paycheck for a certain length of time during that year. So remember in the example, if you made $4,000 over the earnings limit, they're going to defer $2,000. If your benefit is $2,000 a month, they're just not going to give you a check in December. So what you just did is you missed a month. Make sense? You didn't get a paycheck for a month. Once you hit full retirement age, they're going to adjust your benefit. They're going to add back in the month. So your benefit, if you originally filed now, this particular time, and waited 1 month, your benefit would be higher, right? Because every month that you defer or every month that you wait, your benefit goes up. Remember that? So if you hit full retirement age and they add back in a month, that's synthetically like you filing a month after you actually filed initially. So they add that month back in, recalculate your benefit as if you had waited a month. Completely confused yet, or should I keep going? So they do it by time. They add back in. They don't add back in the $2,000. You don't get a check for $2,000. You missed a month of paychecks, right? You missed a $2,000 Social Security benefit. What they do is instead of giving you the $2,000, they take your benefit, recalculate it, and add back in the month of December. They don't add back in the money, they add back in the time. So then they recalculate your benefit as if you had waited a month, which would have meant your benefit would be higher. So basically, if they defer any amount of money based on the earnings the earnings test, when you reach full retirement age, you will get a raise. That's one way to think about it. We can spend more time on that, absolutely, if you want to. I've got a table set up back there in the corner. I've got some business cards and some other need-to-know stuff that you get. Yes, go right ahead.
Vein, could you review that the 8%, if you're at full retirement and then you pause your Social Security payments, then it grows at 8%, is that like for life, or is that, can you just kind of clarify that?
Sure. So your primary insurance amount is the amount that they calculate your benefit to be based on your earnings at full retirement age, which, if you're born in 1960 or later, is age 67. That's what they calculate. Once they've calculated that, then that's something for all of us to know what your primary insurance amount is. Then the Social Security Administration will take that number. They will reduce it down if you file earlier than full retirement age benefit, full retirement age. Then they will calculate it and inflate it at 8% after your full retirement age. So anybody can file at any time between age 62 and age 70, any time in there. Prior to 67, you're subject to the earnings test. After 67, you're not. There's no delay of benefits based on when you file. So you can file right at 67 if you want to. Each month that you wait, your benefit's higher. So they grow the benefit at 8%, but if you hit 67 or full retirement age and wait 1 month, you don't say, oh, darn it, I could have waited 11 more months and gotten the 8% bump up. No, you got a bump up, but it was only 1/12 of 8%. If you turn 67 and make it 6 more months, instead of 8%, you're going to get 4%. So it's every month prorated at 8% a year past the age of 67. It's reduced at a different rate, but it's about 7-ish%. Yes, sir.
So when you say a month, your birth month, say your birth month is May. Is it May 1st or is it May 25th when your birthday is, or how do they count that?
So your first paycheck would be in June.
I'm talking about for the calculating the increase if you wait past. So you say my birth month is May and I want to file May 1st. So June 1st would be the first check, right?
Yeah, so you will already be 67, so then you can earn whatever you want.
So when does it take effect if I wanted to delay it 4 months? Is it from May to September 25th, or is it as soon as September 1st gets there, does it count for 4 full months? Is it from your date of birth or from the first of the month?
I don't know.
Okay.
Sorry. Yeah, apologize. I don't know the exact date they start that, if it's when you file. So that's a great question. I would like to know the answer myself. I just don't know. Anybody else? Okay, like I said, I've got a table set up back there. You've got a lot of great vendors to stop and visit. I hope you'll be able to check in with everybody. And I think that's it. Okay.
Okay, everybody, we're at 9:30, and we need to stay on schedule for the folks who are online. So I'm going to go ahead and get started. My name is Gail Carble. I've worked at the university for 28 years. Very proud to say I've worked in benefits this entire time. I'm going to introduce to you our first speaker on the UK retirement health benefits, Terry Knatzer. She is one of 3 retirement specialists on our HR benefits team. Terry has been at the university for 27 years. She began her journey in the elder care program and has spent the last 13 years, we're lucky enough to call her our benefits retirement specialist. In her current role, Terry provides personalized retirement planning through one-on-one sessions, helping employees navigate their retirement options and fully understand benefits available to them. Coleman Simpson and Kim Cook are the other 2 retirement specialists, and they have a wealth of HR and benefits experience. After this presentation, Coleman will be moderating the question and answer session. We will also have a member of our Know Your RX coalition. Travis Albrecht is a co-director and licensed pharmacist. He has been a pharmacist with the coalition since 2015. Prior to working with the coalition, he was a staff pharmacist for the Kentucky Clinic Outpatient Pharmacy. He enjoys speaking with patients and helping them understand their medications, both pharmaceutical logic behind each prescription, as well as how the patient can save money. And we are happy to welcome Dan Hicks, who is with Humana. Humana is our new provider for our Medicare Advantage plan for retirees age 65 and over. Dan is a licensed health insurance professional with over 15 years of experience with Humana. Dan has worked in almost every facet of the group Medicare space and brings a wealth of knowledge to the account executive role. His primary goals are to build a long-lasting client relationship and ensure that members receive the best possible care. So let's welcome Terry Knatzer.
Welcome, everyone. So we're going to give a lot of information today, but there's going to be plenty of time for Q&A after the presentation, like Gail mentioned. So just save your questions. We'll get to them later. So I need the clicker. Hang on. Okay. So what I'm going to go over with you today is what everybody receives from UK and what you need to know to retire. We're going to go over the dental, vision, life insurance plans and the health insurance plans. So let's start with what everyone receives at UK, free consultations. And these consultations are available to you now for employees, but they also carry over when you retire. So starting with financial planning from CAPTRUST, you heard from Kirk. Kirk is one of several financial advisors with the company. They're a trusted resource that you can lean on for financial advising, financial planning, retirement investments. I have found that when people are close to retiring, they'll have their meeting with their TIAA or Fidelity representatives, but then they'll follow up with CAPTRUST, kind of for a second opinion, and just to have a different type of retirement readiness meeting. And that can sometimes give you the confidence in knowing if you're financially on track and ready to retire early. And then we have Enrich, which offers a wealth of online information, a lot of articles online, short videos on retirement planning, but also budgeting, money management. Both CAPTRUST and Enrich you can find on our benefits website under financial well-being. And then TIAA and Fidelity, hopefully you've met your representatives that are on site here today with TIAA and Fidelity. I think as you're getting close to retirement, really every employee needs to be meeting with the carrier and take advantage of that one-on-one review of your accounts. And when you're close to retirement, having that retirement readiness meeting with them, see how you're doing, how long is that money going to last you in retirement, and how to access money when you retire. How do you go about starting those distributions? So get to know the reps that are on campus because they meet with people often on site, but also virtually if that's more convenient for you. And Know Your RX Pharmacy Group. I'm not going to get into detail with them because we have Travis. He's going to be speaking soon about the Know Your RX Coalition and their pharmacists as a resource to help you with any prescription questions, concerns, that sort of thing. Elder Care program is a free benefit. You could speak to a specialist if you're taking care of aging loved ones, whether they live locally or you're a long-distance caregiver, you have some challenges with that. Talking to someone might help you work through some challenges, but also helping you find resources. And it doesn't matter where your loved one lives. They know the National Elder Care Network and can get you resource information anywhere. And just to promote something that they have coming up really soon, they have a virtual dementia tour on October 28th in the College of Nursing. If you've never participated in this simulation, it is for employees only to participate in it. And it's just a great realistic experience and what it's like to have dementia. So if you're a caregiver and you want to just kind of see what it's like, going through this simulation, I have found that people feel like they're better able to kind of realize the struggles that their loved ones are dealing with to help you be a better caregiver. So take advantage of it. It's a really cool simulation that they have that's offered just to UK employees. Some other programs and resources, we have mental health therapists with Work Plus Life Connections. You can have up to 5 free visits every physical year for you or your loved one, or your family member, I should say. Both Work Life and Elder Care, they have support groups and presentations. Please visit the Wellbeing table just to get a full schedule of all their events and programs. And if you can't attend, but there's a topic that interests you, just sign up for it. Because if you don't attend, you'll get a follow-up email with the copy of the presentations. And if they recorded it, you'll get a recording of it. Let's see what else we've got. We have a dietitian from the health and wellness program. There's a lot of weight loss kind of support programs available as well. And so much more. Just Benefits website is where you need to go to kind of link to all these resources and consultations that are available to you. Some fun opportunities: fitness membership through Move Well, employee-only gym, but retirees can access the gyms at a very low cost. And they have a lot of other opportunities, such as health coaching. Health coaching is a way to get personalized consultations to help you set goals to better manage certain things that you're struggling with. Like, for example, getting better sleep, managing your work-life balance, improving relationships. So with these health coaches, they help you obtain these goals. We have an annual retiree fair in the fall, hosted by the benefits office. Not to be confused, it's nothing like this retirement conference here. These are already retired employees, and they come together. It's a great way to socialize with others. We have found that they like to meet up and socialize with one another, and but you'll learn about any updates and benefits. You get to meet the vendors that you have resources with, but we also invite some community programs and volunteers. So once retired, you'll get this invite, and you can come to this retiree fair every year. Some other activities: Osher Lifelong Learning Institute. They were scheduled to be here today. Something must have come up. But if you're 50 or older, you can take advantage of their enrichment and activities and programs that they offer. Check out their website. They have some very cool programming opportunities for people to be involved with. And then through the UK Donovan Scholars Program, if you're 65 plus, you can take courses at UK for free, which is a nice continuing way to maybe fulfill a lifelong dream of taking courses or maybe obtaining another degree. Okay. So before we get into health insurance and what it costs, and a lot of what factors in is when you're going to retire. So first off, there's no set retirement age. Early retirement is before 65, and you have to meet 2 criteria for early retirement. The first criteria is that we're looking at your age and your years of service. They have to equal 75, and you have to have 15 consecutive years in a regular position. If you're staff, you're encouraged to give a 90 calendar day notice. For normal retirement, if you're 65, that's considered normal retirement. Regardless of your years of service, you can retire. And staff are encouraged to give a 30 calendar day notice. It's not on here, but if you are faculty are asked to give a semester's notice, especially for teaching faculty. Phased retirement, we're going to talk more about that on another slide, but phased retirement is before retiring, so you're not fully retired yet, but if you're 60 and you have 15 consecutive years of service, you can talk to your department about possibly a phased retirement agreement. So what's your official years of service, to get an accurate understanding of that and how that would, if you qualify to retire and you meet the age and service requirements for that, best way to check in, if you haven't already, is to contact the retirement office. This email address, retirement@uky.edu, is a way that gets to all 3 of us that work in the benefits office. We'll get back with you and give you a service letter that tells you exactly your years of service for retirement, and if you get the health credit, that can sometimes help you better understand where you are. And if you are not eligible, we'll certainly project when you would meet that criteria for that. And just a heads up, we usually get a lot of requests for service checks after a retirement conference. Please be patient with us, because we do prioritize getting back to you, because probably at the same time we're getting requests in for people needing to retire soon. But we will respond to you if you email us for that request. Okay, so phased retirement, just a little more information, detail here on phased retirement. I look at it as a way of easing into retirement. I think it's a great program. You can reduce your FTE no less than 50%, but no more than 80%. This does not impact your health insurance benefits in any way. Even if you're 65, often people wonder, okay, well, if I enter phased retirement, I'm 65, am I going to have to file for my full Medicare? And the answer is no, because you're still, in our eyes, an active employee. The employee insurance needs to be primary. So benefits are not impacted. You still get the retirement match, but that obviously is prorated because your salary is reduced. One of the perks is you can access your retirement contributions while you're on phased retirement. So you would need to work with your vendors, TIAA and Fidelity, on requesting phased or getting that started. But it's also helpful to let us know in the benefits office, because we can ensure that your status is showing a certain way with the carrier system, so they know you can pull money out to supplement your income if that's something you needed to do while on phased retirement. And then this final bullet here, your department, not HR, grants phased retirement. We want to throw that in there because it is not our office that approves phased retirement. There's a lot of levels that it has to get approved by, and it starts with your department. Not all positions can accommodate phased retirement. So we think it's important, if you know you qualify, if this interests you, have that conversation with your supervisor to see if it's your position can be supported in that way. Some departments may only approve it on a year-to-year basis, but we do see some that have them in place for a full 3 years. Okay, some more detail on early retirement and just understanding more about the eligibility criteria that we're looking at. So as I mentioned earlier, you have to meet the 75 rule. Age plus years of service have to equal 75. And we're looking at your years of service. And if you are less than 100% FTE, it would be prorated. For example, if you're 15 years working in a regular full-time position at 100%, that is equivalent to 20 years working in a regular position classified at 75%. So for retirement years of service, not to get confused with service awards that sometimes you get from your departments, we're looking at it very differently. We're looking at your FTE. Those years have to be continuous with no interruptions, and we're looking at if it's a regular position, because temporary positions or even on-call position doesn't count towards your retirement years of service. Normal retirement requirements, so this is at 65. For access to the health coverage at 65, you do have to have 5 consecutive years in a regular position with 100% FTE. And for the health subsidy, 15 years in a position is factored in as well. So again, 15 years working in a regular position is equivalent to 20 in a regular position at 100%. And we're looking at those years being continuous and with no interruptions, and that it's a regular position, not temporary positions, because that would not count. Okay, talking about unused sick leave, because this comes up often when we're having benefits meetings with employees on retiring. What can you do with that unused sick time? Well, if you have 66 days of TDL, that could be, and you were hired prior to July 1st, 95, you could be eligible for a financial payout. What does that look like? Well, 22 days gets paid at your hourly rate, and then the remaining of those hours get paid at 10% of your hourly rate. And when we're having a meeting with you, we will estimate, if you qualify for a financial payout, we will certainly give you an approximate estimate of what that might look like. You could also use that to move up your retirement date. I had somebody last year that was eligible in February 2025, but they had another job and were going to move out of state and wanted to move up their eligibility. They had over 4 or 5 months saved of TDL time. So rather than having to wait to retire in February, they moved it up to retire in November of 2024. So that's something that we could also look at with you if you have a substantial amount of TDL time. That could help you in that way. Also, if you were hired after July 1st, 95, again, you could use it to move up your retirement date, but also can add to your years of service if that could benefit you. For example, if your premiums for insurance is based on the age service matrix, I had someone do this actually last year as well. They had 24 years, 11 months of service, something like that, but they had over 4 or 5 months of TDL time. They were able to use their conversion to get them to 25 years, which lowered their health insurance premiums for them. So again, these are things that we could look at. If we think you could benefit from it, we will definitely talk it over with you. And not on here, but I think we probably should be adding this. If you can't take advantage of the TDL conversion in any way, you possibly would, if you have 66 days every year in April, you can do a conversion to add more vacation days. So we don't necessarily work with that policy. We would refer you to Employee Relations or the Employee Relations website on that, but it is something to think about if you can't take advantage of a payout or add to the TDL conversion. Every April, you'll get an email, and you could add more days to your vacation time. Okay, vacation leave, you can get a vacation payout up to 1 year's accrual. So I always tell people in meetings, if you have substantial amount of vacation time as you get closer to retiring, you want to make sure you're not in a position of losing something, losing some time. But we'll look at that when we have benefits meetings with you. And payouts, whether it be vacation, sick time, or both, what you can do on your final paycheck. If it's substantial, you can possibly tax shelter, put that money in a voluntary 403B or 457 plan with your TIA or Fidelity account, and that could possibly help you on taxes. We can't give financial advice in the benefits office. We would say lean on TIA, to lean on Fidelity, CAPTRUST, or your tax person that you work with could probably give you some advice on that. Life insurance, so generally, as you get older, the less life insurance I think people do need, but we're not experts in life insurance, but the basic life insurance that you have will end when you retire. If you have the optional life insurance, that is through Prudential, we will give you a retirement checklist that'll have their phone number. You can reach out to them prior to retirement about a conversion option that they will give you. And what that means with a conversion is it's a guaranteed issue with that company. It is term life, and term life plans tend to get more expensive as you get older, but it is an option for you to reach out to them and see about converting that plan to continue that term life plan when you retire. The NPM group does have a universal life insurance plan, and if you have that plan at retirement, we'll encourage you to talk to the NPM group about porting that plan with you because there's a cash value to it. You certainly want to take some action with that plan, whether continuing it, taking it with you, but the prices do not go up with the universal life insurance plans like it would with the term life plan. Okay, so we're getting into the health insurance for retirees, and a lot of factors come into play when it comes to whether you get the health credit. We're going to be looking at your date of hire. Are you hired after 2006 or before 2006? We're going to look at your years of service. We're factoring in the date when you're going to retire and the age at when you're retiring, and if you're also coming back to work through UK. because that can have an impact on what your health insurance is going to cost. Okay, so this is very important to know. We have on our benefits website, there's a lot of employee information, but you'll see a retiree tab. And if you go there, you have the retiree benefits booklet in front of you now. We always have updated books online. As a matter of fact, I think we might be having a new book online soon to reflect some changes in January with our new contract with our Medicare Advantage plan. So always visit this page, but if you're having a retirement benefits meeting with one of us, we'll certainly make sure you get a copy of that and all that information in front of you. See. I'm going to talk real briefly on the dental insurance. Dental insurance plans don't change very much. If you have Delta Dental, same premium, same plans. There are no changes with the Delta Dental plans when you retire. But if you have UK Dental, there is a slight change because they do not have the basic plan or the comprehensive plan. They call it the UK Dental Classic, UK Retiree Ultra plan. So they're very comparable, but there are more coverage that you get with the retiree dental through UK Dental, and the premiums are a little higher. Best way to really look that over closer is just to get our benefits booklet out. And what you're seeing as far as is a cost range over there to the right. But check the benefits booklet. There's a dental page in there that lines that clearly out for you. For vision insurance, it is through IMED, and I can say that there are no changes in the IMED plan, same cost. And then summary of the health insurance, if you are under 65, it is the same health insurance plans available to you as an employee. The cost differs on your regular service date and if you're eligible and when you're retiring. If you're 65 and older, then it's a Medicare Advantage plan that you can be on. Unless you return to work through steps or post-retirement appointment at any time, which we'll talk more about that here shortly. Okay, we're getting into some complicated charts. I may need to turn over here just to see it. So if you're under age 65, your monthly cost is going to depend on if you were hired after January 1st, 2006 or before 2006. You're going to see this little teal green color over here. If you were hired after 2006, for the HMO, for example, the $1,223 on that far left is what a single plan would cost. We're just showing you the range. So like at the very high end, that $2,868, that is if you're covering family on your plan. If you are hired before January 1, 2006, and you are eligible for the health subsidy or health credit, UK is going to pay a percentage based on your age service, and we're going to look at that chart a little closer here on the next slide. But at the low end, someone maybe a single person on an HMO would pay $183 per month if they were 64 and they had over 25 years of service. So this chart here is really helpful if you're in the age service matrix, you know that your cost would be based at the age of your retirement and your years of service. This shows you the percentage that you pay, and you'll see if you're not 60 and you have between 15 and 19 years of service, you're going to pay a higher percentage of the cost. But if you were someone 64, have 25 plus years of service, you're paying 15% of the cost. So not as much. And what I like to point out to people here, if you get the health credit, if you're 65, it's not the same health insurance plan you would go on unless you're coming back through steps, possibly. but you're only paying 10% of the cost, or $8 a month, for our new contract that we have in January with Humana for the Medicare Advantage plan. Another thing I like to point out here is that you're locked in at that age at retirement, so it doesn't lower as you have birthdays and you get older, and get closer to 65. So you'll get material during open enrollment periods, just like employees do. We mail those packets to your home, and you have to look at, well, okay, I retired at age 63. I know I have my 25 plus years of service. Then you're paying 20% of the cost of the insurance. Okay, so let's look at some of these costs here. Let's look at that example. If you're not 60 yet and you have 19 years of service, you're paying on the HMO $978 a month. But let's look at that scenario of age 64 with 25 plus. Like I said on that other slide, $183 would be your cost. If you're adding dependents, once you retire, dependents are no longer eligible for a health credit. So it can get expensive. For example, a spouse, adding a spouse, if they're not 65, that would be on top of the $183, $1,588 per month. And for the PPO, let's see. PPO, it's slightly higher cost. So that same example of less than 60, you have 15 between 19 years of service. A single person would be $1,033 a month, versus if you were 64 with 25 plus years of service, $194 a month. Adding a spouse on that, if not 65, you're adding an additional $1,681 to that premium per month. Okay, and let's talk about the Medicare Advantage plan. Again, we're looking at your date of hire. If you were hired after 2006, you're paying the full group premium, but if you were hired before that and you have 15 consecutive years of service, you are getting a health subsidy. And we have a contract changing in January with Humana, and wow, is it competitive, and it's a good rate. So someone that does not get the health credit for a Medicare Advantage plan, they would only be paying $82 a month. $8 a month if you were hired before 2006 and you have 15 years, you get the health credit. One heck of a deal, but that 82, I would say, is probably very competitive, if not a better rate than possibly you could get outside of the university's plans. This is for Medicare Advantage plans. And if you're adding a spouse and you don't get the health credit, that's $164 a month. With the health credit, it is $90 a month with spouse. Okay. And here's some information about steps. If you retire from the university, you could only be rehired through steps or a post-retirement position. A lot of post-retirement positions are faculty assignments. I would say 99% of those positions are faculty coming back. If you work 20% or more, you return to work no later than 3 months after your retirement date, you're eligible to remain in your current Anthem plan, that HMO PPO plan, and pay the same rate. Even if you have dependents on your plan, they get the employee rates for 12 months. This has to do with the Affordable Care Act, 1-year stability period, that policy. One thing I would say is talk to the retirement specialist you're working with. If this is something you're considering, let us help you figure this out so you know exactly what those rates would be and how that plays in with the Affordable Care Act. If you come back 3 months after your retirement date, it's reduced rates for retirees and your dependents. We're going to look at another slide for that information. But if you're 65 and you come back to work through steps or post-retirement, you need to stay on the employee plans. If you're working 20% or more, you wouldn't need to file for your Medicare B yet. You could delay that and stay on Anthem's insurance longer. We will help you file for the Part B later. So this is the working retiree chart. If you were rehired after 3 months after you retired, or if it's after the stability period has ended. If you were hired after 2006, you're going to pay higher premiums, but it's lower than the retiree rates that or group rate that we get with Anthem. So like an HMO single plan, it would be $7.99 a month. Definitely lower than the retiree rate. But if you get the health credit, you're on the HMO, it's $55 a month. That high end, that $1,533 cost is if you're covering family. And PPO, it would be higher premiums. Okay, some contact information that we think is important for you to know. Obviously, we have a customer service line you can call during business hours, Monday through Friday. Always connect to somebody with general questions. Oftentimes, our customer service team can answer a lot of general questions. You have the contacts to reach all the retirement specialists. Best way to connect with us, especially if you want to schedule a meeting, is the retirement@uky.edu email. We'll send you a booking link, so it makes it a little easier because you can pull that link up and then pick a time that works best for you, and you'll get scheduled with somebody. Unless you're working with somebody already, you could reach out to that person, but I think that's the best way to connect with us. Let's see. Oh, and Kim Cook and Coleman Simpson, those are my colleagues. So we all three are checking that retirement email. And then Keely, you can raise your hand in the back. Keely Nays, we work very closely with Keely. She manages the retiree billing and any changes later with retiree plans. So the retirement specialists, we're going to get you all set up for retirement, get everything started, but then later, like if you're working through steps and your steps is ending, we usually involve Keely at that point because she gets the notices from steps and will help you transition from employee to retiree plans at that time. And then medical claims issues, just know we have a benefits advocate that you can always reach out to, Debbie Martin, if there are claims issues. I would say most of the time they're not a lot of issues that people have, but if you do experience any issues, she's a good number and contact to have in our benefits office. Okay, I am now going to turn it over to Dan, who's going to give a presentation. Dan is with Humana and is going to talk about our new contract that we have with Humana.
All right, good morning, everybody. Can you hear me okay? I'm tall. Let's see this clicker. All right, so good morning, everybody. My name is Dan Hicks. I'm a group Medicare account executive with Humana, so assigned to the University of Kentucky. Just want to start off by saying we are extremely excited to be partnering with the University of Kentucky to administer the Medicare benefits effective January the 1st. So a little bit about me. I've been with Humana 17 years as of last week. Been in the group Medicare space, started in the call center and kind of have worked my way up. So just a little bit about myself. I reside outside of Jeffersonville, Indiana. And I'm going to quickly go through just a little bit of history on Humana. So we are a Kentucky-based company. We were founded outside of Louisville or in Louisville in 1961 as a nursing home. We've been in the Medicare space since 1987. So Medicare Advantage is what we do best, and we couldn't be more excited to be partnering with the University of Kentucky to administer their benefits. So before I get into how the plan is going to work with Humana, I know Kirk mentioned in the back just kind of a little bit of background on Medicare. So when you turn 65 and you are eligible for Medicare, you sign up, you're automatically entitled to Medicare Part A. So you'll hear like A, B, C, and D. So Medicare Part A is your hospitalization And then you have the option to enroll into Medicare Part B, which is your physician services, outpatient services, those types of things. There is a Medicare Part B premium that you have to pay. In order to be eligible for the Humana Medicare plan, you have to have both Part A and Part B. And so Humana you'll hear it, Medicare Part C, which is Medicare Advantage. And so effective January 1st, so we will be the Medicare, the medical provider, and I know Travis will be speaking here in a little bit. So the Part D coverage will be through Express Scripts and Know Your RX. So Humana will just be hospitalization, outpatient services, physician services, that sort of thing. So like I said, in order to be on the plan, you need to have Medicare's Part A and B to be enrolled in C. So the Medicare Advantage plan through Humana is a preferred provider organization, or a PPO plan, you'll hear it called. The great thing with this plan with Humana, it's called a passive PPO. With a traditional PPO, you would have in and out of network benefits that are different. With the passive PPO, your in and out of network cost share is the exact same. So the great thing, when speaking to providers that take, are they in the Humana network, or are they out of the Humana network? So in network means that they have a contract with Humana. Out of network means that they don't have a contract, but they are willing to bill Humana for services. So the great thing with this Humana plan for UK retirees, as long as the provider is willing to bill Humana for services, then there should be no disruption or no issue. And then also your cost share is the exact same, is of whether you're seeing a provider that's in the network or out of the network. With this plan, most preventative care is covered at 100%. There is nationwide emergency coverage. For those that like to travel outside of the country, there is worldwide emergency coverage as well. And like I said, the cost share is the exact same regardless of whether you see a provider that is in our network or out of the network. And if I'm talking fast, please, if you have questions, please feel free to stop me and raise your hand. So I'll just get into a little bit of the benefits, just a high-level summary of what the benefits on the Humana plan will look like. So there is an annual deductible of $185. So what that means is once your medical spend, the first $185 is yours. Once that deductible is met, that is when the insurance coverage with Humana would kick in. With this plan, there's an annual maximum out of pocket. So once your medical spend reaches $3,000, all services are covered at 100%. So physician services, my apologies. So outpatient hospital visits, depending on what service you're receiving in the outpatient setting, it's anywhere between covered at 100% to a 4% coinsurance on your part. Inpatient hospital would be a 4% coinsurance, as well as primary care physician's visit, specialist office visit, durable medical equipment, all at a 4% coinsurance. ER care, emergency room care, so it's a $100 copay. So once you have reached your deductible of $185, then your copay would be $100. And then urgent care is a $45 copay. Yes, ma'am.
Is that Medicare covered ER visit? Are there times it doesn't pay?
It depends. So with these benefits, so all of the services that we will cover are Medicare covered services. So if they bill anything that's outside of what Medicare would typically cover, that is what we would not cover anything that Medicare would not cover. So I think that's just a standard, $100 copay for Medicare covered emergency room services. So if they're billing for something that is not Medicare covered, that's when, we wouldn't have that coverage. That makes sense. Yes, ma'am.
Yeah, when you say 4% of the cost, you only pay 4% of the cost?
That would be your responsibility, yes. So the retiree's responsibility would be 4%, and then Humana would pay 96. Yes? Yeah,
Okay, so you said you have to have the Medicare A and B.
yes.
So is it any point Medicare paying, or is it all the payments are coming to Humana?
So we are the primary, so you would show your Humana card. You would not need to show your Medicare red, white, and blue card. Keep that in your wallet or with your personal items. So Humana is the primary and only payer for the Medicare coverage. Claims do not go to Medicare. Make sense? So we are administering so when you turn 65 and you're Medicare eligible, we are administering those Medicare benefits through the Medicare Advantage plan. Any other questions? Yes.
So I know with an HMO, like if I decide I need to go to a foot doctor, I can just go without a referral from a primary care physician. So I thought PPO used to be where you needed that sort of a referral to go to. Don't do that anymore?
That's just strictly with an HMO. So the Humana plan for UK retirees is a PPO only. So yeah, no referrals are required. Yes?
You might want to mention the out-of-network too.
The out-of-network, yes. So, and with the PPO plan, so you have coverage with a provider that is in the Humana network and out of the Humana network.
So I'm a little confused, I
Yeah,
guess.
sure.
So you have Medicare A is free once you do Medicare. Medicare B, you have to pay, comes out of your Social Security kind of thing. A pays for the hospital, B pays for medical visits and outpatient. So I'm confused, I guess, if you have A and B, why do you need C?
So if you have A and B and you want to be on the Humana plan, that would be considered Medicare C. So it's C covers what A and B would cover.
So normally if you had A and B, you'd be out at 20%, is that what you're saying?
Yes.
And so having C, but then you're paying B, because you have to pay for B, and then you're paying C also.
Right, which is what Terry just stated before, what the premium would be. That would be your C premium. So C, just think of C as Humana. That's Medicare Advantage.
But you don't have to have C if you don't want to.
Correct. Yep. That is if you elect to have your retirement coverage through the University of Kentucky, and their Medicare plan is through Humana. Any other question? Okay. So also with the plan, so routine hearing, vision, acupuncture, podiatry, personal emergency response system through Lifeline, and then also wigs are covered. These are services typically not covered under original Medicare, but with this Medicare Advantage plan through Humana, these routine services would be covered effective January 1st. So, yeah, sure.
So are you saying that with this plan, you wouldn't need my health, dental, or excuse me, not my dental, but my vision insurance?
So, yeah, so dental would not be covered under Humana, but routine vision, hearing, acupuncture, those are all covered services under the Humana plan. So you wouldn't need to go out and take out a routine vision plan or a hearing plan, because that would all be covered under Humana.
Or may I have a separate plan for that IMAP?
Yes.
I wouldn't need to continue that because it's covered here.
Correct. You can obviously look to see what policies are, but they're, just specifics on what that would be, the routine vision. So it would be, an office visit would be covered, a routine office visit would be 100%, so it wouldn't cost you anything for a routine visit. And then you also, seeing if there was any eyewear. Yep, Yeah, it looks like it's just the routine office visit is covered at 100%. In all of these benefit information, and I'll get on a later slide, if you sign up for retirement coverage, we would mail you out a packet with all of the benefit information. So if you elect this coverage, you would be receiving information from Humana, which I will get to on a later slide.
I just wanted to verify, so hearing and vision, we're covering an office visit, we're not covering hearing aids or glasses or contacts, you're just covering the visit.
So the routine hearing benefit, so it's covered, an office visit is covered at 100%, so no cost to you, and then there is a $500 per hearing aid per ear benefit. So you have a $500 maximum benefit for hearing aids. Yes?
Was that every 3 years?
That's
Thank you.
once every 3 years, correct. Okay. So going to get into, so once you enroll in the plan and you receive your Humana letter, you are eligible. You can sign up for My Humana. So we have a mobile app, or you can go to myhumana.com and you can plug in your Humana information. So with My Humana, it just allows you to access all of your claims. You can find providers that are in Humana's network. You can order an ID card if you misplace yours. It's a really good resource for you just to kind of stay on track with all of your claims history. This right here is a smart summary. So if you have a claim, if you've incurred a claim for the month, we are required to mail you out a Humana Smart Summary. You can pull this Smart Summary information off of your My Humana account, but this just gives you detail on the claim that came through, what was total, what the total charge was, and what your responsibility is. I would just advise, if you've been to the doctor for any reason, do not pay that bill right away. Wait for this Smart Summary to come in, or go to My Humana just to see how much Humana is paid before you pay a bill to any doctor. So we offer clinical support programs through Humana. So we offer an in-home health and wellness assessment. So once you enroll into the Humana plan, you will be receiving a phone call from Humana. So a licensed doctor can come to your home and give you an in-home and wellness assessment program. It helps, if there are any gaps in care, for you, it just helps give a better picture of your health. We also offer care management programs, also primary care, access to primary care, getting into post-hospitalization support. So if you've been in the hospital for any reason, or in, say, like a skilled nursing facility, we have a Humana Care program where our care nurse can help you get you back on your feet. They can either, get you from the hospital to skilled nursing, or from skilled nursing, they can help you with home health. They can do occupational therapy, and then they also can help with post-discharge transportation. So with this benefit, you can have, you're entitled to 12 one-way trips, up to 50 miles, and this is if you've been in the hospital or in the skilled nursing facility. And they will also help with post-discharge meals. So you are also entitled to 2 meals per day for 14 days. And that is if you've been in the hospital or at a skilled nursing facility. These last 2 programs I'm going to touch on. So the first one is Go 365. So this is our wellness program. So it's our total rewards program. So if you have your annual wellness visit and you sign up with Go 365, I believe it's $25 you can redeem in gift cards. If you have 12 or more workouts that you record, if you've been to the gym, or you're an active walker, you can record those activities onto Go 365. And then you can go to the Go 365 mall and redeem those for gift cards. Kind of coincides with our Silver Sneakers program. So this is our free gym membership. I believe it's like 18,000 gyms that are participating with Silver Sneakers throughout the country. The awesome thing with Silver Sneakers is you're not tied to just one gym. If you vacation or you have a second home in Florida or wherever, you don't have to just go to one gym. Enrollment is easy. You just show your Humana card. And they also are now into the virtual with silversneakers.com. They have virtual exercises and classes. So if you don't want to leave your home and go to the gym, you can go to silversneakers.com. And like I said, enrollment is super easy and it's free. So this is an example of, this is our enrollment kit for the University of Kentucky retirees. So if you elect, you are Medicare eligible and you've elected to be on the Humana plan, we will mail you out a packet. So we will work with the University of Kentucky benefits office, and we will get your information and send you out a packet. Everything that I talked about will be contained in this packet, including a summary of benefits, which is just a general overview of the benefits offered with Humana. And then this last slide just talks about what to expect once you've enrolled. So once we work with the University of Kentucky, they provide us with your Medicare information. We will begin your enrollment process in our system, and then we also will coordinate with Medicare to make sure that everything's up to speed. So once you are enrolled, we will issue out a letter just thanking you and welcoming you to Humana. That will contain your Humana information. And then once you receive that letter, you'll get your Humana card in the mail. And as I stated before, you don't need to use your Medicare card. You would just use your Humana card for all medical services. Then once you receive your card, you'll have access to your evidence of coverage. So it's about 350 pages long. We don't have to physically mail these out anymore. You will get a postcard in the mail. You can either go out to the Humana link to view that online, or if you do want a physical copy, you can contact our customer service team, and we can get you that evidence of coverage document mailed to you. So it includes all Medicare covered services under the Humana plan. It's a pretty big book. And then the last thing is the health and wellness assessment. So you would be, like I said before, you would be contacted from Humana to take that annual wellness assessment. Again, it's completely, it's completely optional to you, but that is something, that's the last bit of information that you would receive from Humana. So I know I walked through that fairly quickly. Does anyone have any further questions about Humana? Yes?
How often are you negotiating provider contracts? Because we hear about providers that no longer accept the certain Medicare Advantage plans, or they're going to drop them and stop accepting them. So how often does that change?
In all honesty, there's always...
Dan, can you repeat that for those online?
Yes. So the question was around providers accepting Humana. How often, how often are we talking, as far as like contract negotiations? The one thing I could say is these things are happening kind of all the time. I mean, there's not one provider, all provider contracts are different. The one thing that I can hammer home here is, if your provider is saying they will not take Humana, first thing is call Humana first and let us reach out to your doctor to explain the passive PPO. The one good thing about the UK plan that is different than a lot of other even Humana individual products is this passive PPO concept. So 9 times out of 10 in our conversations with providers, if we explain it's a group Medicare plan, it's a passive PPO plan, which means that the retiree's benefit is the same regardless of in or out of network benefits, they will accept and agree to bill Humana. I would just, if you have a doctor that is unwilling to take Humana, please call us and we will do everything we can to talk to your doctor to get them to bill Humana. Yes.
Can you get in or out at any time, or is it a specific time that you have to enroll?
I would say, Terry, the question was, can you elect in or out at any time into the UK plan?
So the way that it typically works is that at the time of your retirement, you're allowed to opt in. Otherwise, you can defer your insurance. Typically, to come back on after that, you either have to have a qualifying event. So, for example, if at the time of your retirement you elected to go with another plan and you wanted to come back onto the UK plan later, you would just need to show proof of at least 1 year's prior coverage. So another Medicare Advantage plan, Medigap plan, and then proof of prescription coverage since you turn 65. You can either come back on during Medicare's open enrollment in the fall, or, like I said, with a qualifying event. So if you have another Medicare Advantage plan and for some reason that plan is ending, that could potentially be a qualifying event to come onto our plan. So it is not any time, but with a sort of standard qualifying event, much like now, or during Medicare's open enrollment in the fall, which is usually around mid-October to very early December. October 15th to December 7th tends to be about the normal time. So you can come back on during those time periods.
Any other questions? Well, thank you so much for your time. I will hand it off to Travis. Thank you all.
All righty, now for the exciting part. We've talked about retirement. If we can retire, we've enrolled in Medicare, we saw our doctor. Now we get to go to the pharmacy and get our drugs. Who's excited about drugs? All right, there we go. I like it. It's still a little early. I got plenty of math in here, so I saw some people taking notes. You'll get to continue to work out your brains as we walk through the wonderful world of Medicare Part D, which is carved out of the Humana plan. So without any further ado, we'll get started. My name is Travis. I'm a pharmacist. I've worked here at UK for a little over 12 years now as a pharmacist. Before that, I did pharmacy school here, I did undergraduate here, so if you've seen me around campus, I've been around here a while. So glad to see all of you have made it to considering retirement, and I wish you the best of luck. So if I don't answer all your questions or we run out of time or something, please feel free to give us a shout here at kyrx@uky.edu. We have pharmacists there ready to respond, to give you some advice or address your particular questions. A lot of times you don't want to bring up your drugs or medications while we're here in the room. You can reach out to our pharmacist and ask your specific scenario and see how it applies to you. So we're going to talk about kind of two different categories when we look at retirees. If you retire and you're not 65, the prescription drug plan that you're going to end up on looks just like the employee plan. It's a commercial plan, you can use copay cards, everything looks the exact same. You don't have the Medicare Part D plan until you're over 65 and you're retired. So you got to check both those boxes and then you're in a whole new world of Medicare Part D. They're both carved out to Express Scripts. It's a carved out benefit. It took me a long time to understand what people were talking about when they talked about carved out. But typically in health insurance, you go to Anthem or Humana or United Healthcare or somebody, and they have a pharmacy benefit just kind of built in. There's no other card you have to show at the pharmacy. What we've done here at UK is carve that out. It gives us a lot more flexibility, a lot more freedom, a lot more options to offer the members and everything as we move on through this journey. And that's why we have a whole team of pharmacists helping navigate it. So we're pharmacists that are just there looking at pharmacy benefits to help guide you through the whole process. So on the prescription benefit plan, it's the HMO, PPO, just like what you have now if you're pre-65 retiree. Spouses and dependents are covered under the same ID card. So we get this question a lot, I need a new ID card for my wife or my child for Express Scripts. It's all going to have your name on it if you're the sponsor for the plan. So that never changes. But the Medicare plan is a little bit different. Each member gets their own card. If you have a spouse that's getting on the Medicare plan, as a UK member, you're kind of the sponsor that got them on there. Your name's not going to be anywhere on that card. In Medicare, everybody has their own plan. Nobody's going to have a dependent. Nobody's going to be a dependent on a Medicare plan. It's your own plan with your own card, your own accumulators, and all that fun stuff. And both those cards are going to have Express Scripts. They're going to have UK on it. And when you Medicare, you get that Medicare RX badge on there. This slide here highlights the difference that you see if you're on the commercial plan and then you move into Medicare. Some of the advantages of the Medicare plan is there's no minimum like we see with the commercial plan. There is, $8 minimums on generics, for instance, on the commercial plan, whereas in the Medicare plan, there is no minimum. If the drug's only $3 or $4, you only pay 20% of that, and it just drives down the cost a little bit lower. There turn out to be a handful of differences on what card you're going to show to the pharmacist and when. It changes a little bit with regards to vaccines or different medical supplies that you'll obtain at the pharmacy. And some of the ACA, Affordable Care Act, healthcare reform, those things have a little bit different impact on the Medicare plans. Medicare, we don't call it ACA or healthcare reform, it's the IRA. And that was passed a number of years ago that have limitations on like your out-of-pocket maximum and a handful of other services that vaccines that now apply to Medicare D. So it's a different flavor of kind of the same regulations that we work with. But here on this chart, it's a really good example of knowing, hey, what card do I show and when? We do have a handout that we can give to members. If you call in, we can mail it out to you, and it gives a little bit more robust breakdown. And the handout I have back there has a few of these examples played out for the most common things. One big thing, if you guys are using the UK pharmacy, there's 9 locations, I think, here on campus, and 11 throughout the whole state. But UK members, if you see a UK doctor and use a UK pharmacy, they do extend a 50% discount. That's outside our benefit that we're administering from the benefits department. It's something that they offer, but they cannot offer it to Medicare members. There's legal hurdles in there they would have to jump that just are impassable. So if you're going there and you no longer get the 50% discount when you move into Medicare, that's why. They don't have control over being able to offer that. And a few more fun things that are just high utilization items that we see on the plan that we like to call out in meetings like this because it may spark kind of some questions or spark you to say, hey, I need to remember that and call Travis down at the Pharmacy Coalition later today and get some more clarification on something. A big thing with Medicare that we see, cough and cold medications not covered on a Medicare benefit. So most of those are actually over the counter now anyway, and we don't see them as much of a crossing point, but that is kind of a big shock that we see members don't get coverage for. So the UK Medicare prescription Part D plan is a Part D plan. I mentioned it earlier with the IRA. We have rules that we have to follow and everything, and a lot of those are to protect members of the plan. So one thing in Medicare Part D is we can't do negative changes during the year. I think somebody had a question about coming in and out of network and joining and getting out of the plan. If there's a drug that's on formulary January 1st, it can't be removed from formulary until the next year. So there are no mid-year changes, there's no quarterly changes. Once it's set, it's set. We may not have control if a drug gets pulled from the market. We would still cover it, but you won't be able to obtain it. But that's kind of a different scenario. So Medicare typically runs, if you have the benefit January 1st, it's going to stay through the whole year and things won't be removed. Do not enroll in another Medicare Part D plan. Do not enroll in another Medicare Part D plan. If somebody calls you and asks you to join their plan, unless you intend on leaving the UK Medicare plan, because you can't be in 2 different plans at once. Every year we get a handful of members, and through no fault of their own, I feel like a lot of times you get on the phone and they start talking and you feel like this is something you have to do or you're going to go bankrupt. It's definitely make sure you're considering the plan you have now, which is an extremely rich benefit, and making sure that if you want to add on to it or if you get another one, you will be leaving this one. You will not be duplicating your coverage. In the Medicare Part D plan, oh, yes. Man, we have a.
So I just want to confirm that with the Humana Medicare Advantage plan, I would not have to sign up for a separate Medicare Part D
That is correct.
plan. Okay.
It all comes together. Excellent question, by the way. In case anybody online didn't hear it, if you're signed up for the Humana Medicare C, like A, B, and C package, you do not have to then sign up for Express Scripts Part D. It's part of the package through UK and the whole Medicare benefit. So on the Medicare D plan, I told you it was a standard Medicare D plan, or a Medicare plan. Medicare D, the standard deductible is, I think, $615. UK has what's called an egg whip, and the W in that stands for WRAP. The most important part of that is you have your standard Medicare benefit, and UK wraps around it and offers you more. So while the standard Medicare benefit is over $600, or deductible is over $600, you don't have to experience that deductible. UK covers that deductible, so you have that 20% coinsurance from day one. You don't have to satisfy the deductible first. There's no longer a coverage gap. This started in 2025. The coverage gap was gone, so you may hear about that in old tales about Medicare, the donut hole that people fall into and lack coverage. That's all gone. You now have a deductible phase, which you guys do not experience. Then you move into the coverage phase, which you guys start at day one, and then you move into catastrophic. Catastrophic is where any covered expenses through the Medicare Part D plan are $0 for you. Once you get to catastrophic, you pay nothing the rest of the year. Then all those accumulators start over January 1st. Important thing to remember is if you start Medicare, if you retire and you jump in, you join the plan December 1st, your accumulators start over January 1st. Everybody starts over January 1. It's not when you started Medicare.
I have a question.
Yes, ma'am.
So if
I'll restate the question.
So if I just don't take the Humana plan and I just stick with Medicare, then I have to get.
You'll have to sign up for something for Part D coverage. Yes, ma'am. She asked if.
You won't get UK Medicare D if you don't sign up with the Humana, correct?
Correct. The question was, if I don't sign up for Humana and I just get my regular Medicare A and B with a red, white, and blue card, will I have this Medicare Part D coverage? The answer is no. If you do not sign up, it's a package deal. You get both or none. Awesome. Good question. This is what I was alluding to earlier against the standard benefit. It's $615. I may have said $685 earlier, but it's $615. And this kind of goes through the member cost sharing of a standard plan. And this is used to illustrate the wrap or the extra coverage that UK provides that goes around your coverage that you're entitled to through Medicare Part D. Our plan has to be as good of or better than the standard Medicare D plan in order to offer it. And that threshold of $2,100. So last year it was 2025 it's 2,000, 2026 it's going to be 2,100. I anticipate it's going to move up again in 2027. But that true out-of-pocket thing, that is a calculation of your drug cost. It's not actually what you're spending, which if we want to get into the math of it, we can most certainly do that when you call our office, but it does get rather complicated of what you get credit towards for that $2,100 versus how much you're actually paying. To jump to the punchline, you're going to end up paying less than $2,100 because of the coverage that UK offers you. But you get credit going towards that much faster. Some enrollment details and tips as we move forward. Sign up for Medicare A and B within 3 months of your 65th birthday. I think we've touched on a lot of this, but we just like to add it in here for duplicative sake. Complete the UK Medicare Advantage enrollment form with Terry over here. She'd be happy to help you. And UK, we send the file over to Express Scripts. who sends it to CMS, Center for Medicare and Medicaid Processing. It is a lot of steps in the process. So with the commercial plan at UK, we can generally jump in and make changes to enrollment or adjust something really quick for you. In the Medicare plan, it's not as fast. If there is an emergency load or something that fell through the cracks, it usually takes about 2 or 3 days to get it, 2 or 3 business days. That's sometimes being optimistic, but to get things fixed and loaded. So in the Medicare space, we do need some patience if there's an emergency or something to get added coverage. You'll be getting a packet from Express Scripts once you get enrolled and everything. It's rather nondescript. So this is that time of your career where you need to be opening up a lot of different pieces of mail and evaluating them appropriately. So it will come from Express Scripts, and it's a big, thick packet. It'll have your ID card and all the enrollment information in there. You'll no longer be using your Social Security number. When we're looking at a lot of benefits and everything, it's a member beneficiary ID. It's an MBI, and it's a unique 11-digit number that's assigned to you. It's not something you're going to have to memorize or anything like that, but just be aware that may be assigned to you as you're moving into Medicare. This is an EOB, explanation of benefits. I think they talked about a little bit with Humana on what you're going to be getting every month. You can elect to receive these electronically and everything like that. And this will have all the math in it that we go over that shows you what prescription drugs you got and how much of those prescription drugs accounted towards your true out-of-pocket cost that gets you closer and closer to that catastrophic coverage phase where everything is zero. So now we're going to talk about, one of my favorite slides is the last slide. It kind of summarizes everything, this kind of alphabet soup of Medicare. And we'll start with the first things first. It's a late enrollment penalty. Late enrollment penalty means that you were eligible for Medicare, you did not take Medicare, and you did not have any other health insurance coverage. So it's kind of like wait until you're sick to go sign up for insurance, and that's the reason that they have this late enrollment penalty. It's a fee that was established. It's a 1% fee of the standard Medicare benefit for that year for every month that you weren't covered. I have an example on the next slide that kind of walks through it. But you may be getting a letter to attest. So let's say you work until you're 70 here at UK. You were eligible for Medicare at 65, and you roll in. Typically, the software and all the computers can figure it out and say, yes, you've had active employee coverage here at UK for the past 5 years. You don't get a penalty. But in case you do get a letter, it's going to ask you to attest for having health insurance for those 5 years. And you can fill out the letter, send it in. We often get calls from people asking for help. If we have evidence that you've been covered, we can attest to that for you, so you don't have to pay that fee. So here's an example. For 2026, the standard Medicare D premium is $38.99. That is, it's established by all the Medicare plans in the country. It's not actually what people pay. It's kind of a fictitious number, but that's what Medicare comes up with. And you pay 1% of that for every month that you had no coverage. So let's say Mr. Smith went 36 months without any insurance coverage after he was eligible for Medicare. After he enrolls, his penalty will be 1% of 38 times 36 months, but it's $14.04 every month for that year. And the next year he's going to have it again. And the next year he's going to have it again. And it's going to go up every year. So while it seems like 1% of a small number for every month, it adds up pretty quick. And we've had patients who've had, $100 a month of late enrollment penalty fees, but they needed to attest, and we were able to get it removed. But it's something to watch out for. IRMA is the other acronym we like to throw out there. It's how much money you're making in retirement while you're on Medicare. And they use your adjusted gross income, and they apply that, and you have a fee associated with your premiums. These are pulled directly from Medicare. This is something that we see get challenged every once in a while by members, and they often can win, because if you retire next year, let's say you were an extremely high earner, and then in retirement, you're not making nearly as much money. You're maybe relying on your 401k or 503b, or your retirement that you have established with the UK. You can get that adjusted to what your actual income that year is, because they look at the year prior. In the year prior, you were working, so it's going to be a lot higher. So that we've seen members, they can challenge this and get it removed. But this is something that you could see on your statements. On the opposite end of the spectrum for that is LIS, which is low income subsidy. So if your income is a certain threshold below, then you qualify for extra help on premiums. And in some cases, your copays on medications can be lowered or even removed down to zero, depending on your situation. One thing that we see a lot of is this status of being an observation. Didn't know really where to fit this in, but this is kind of an FYI you want to file back in your brain. Hopefully you never have to use it, because what happens is members may need to go to the hospital. You're in Medicare, you go to the hospital, and you're under observation for 2 days, but they never actually admit you. If you're in there and they give you your regular blood pressure medication, your high cholesterol pills, or anything like that, that's not a Medicare B covered item. So when you get discharged from the hospital from something that was not even an admission, you get a bill for all those medications. And we need to submit those to Medicare Part D on your behalf. The pharmacy's not going to bill Medicare D. They don't have the mechanisms to do it. So we get a lot of manual claims for that. So if you ever have what's called a non-admission stay, you'll get a rejection from the MA plan, Humana, saying this is not a Medicare A or B covered item, so you need to pay this out of pocket. And then the hospital sends you a bill. We can work on submitting that bill to Medicare Part D so you can get reimbursed for all that. Not expecting anybody to remember the mechanics behind all that or how to work it, but just be aware that if you have prescription drug claims that are being rejected, give us a call. We can help walk through it and see what needs to be done. This is a new program. It was unveiled in 2024, effective in 2025. M3P. It's not a music player, but rather a Medicare prescription payment plan. Oh, thank you. I got a few laughs. And what it is it's an attempt to smooth out costs throughout the year. And it's really effective if you have a very high cost drug at the very beginning of the year that could like max out your threshold of $2,000. Next year it'd be $2,100. And it allows you to pay it over the year, which is beneficial in some cases. For the UK plan, we have maximums on the copays, so you're protected from having that in some scenarios. In other cases with this, if you have a high-cost drug later in the year, the way the calculations are done, you have a maximum first month payment on the M3P program, and then it smooths it out for the remaining payments. So you could have a balloon payment at the end of the year. And depending on when the high-cost drug gets filled and how much it costs, and then your other medications are still going to stack up on it, it balloons at the end of the year. What this program is being sold as is you go to the pharmacy and you never have any cost, but it'd be kind of hard to budget knowing what your plan is every month. If you go to the pharmacy and they don't tell you how much it's going to cost, but we're going to bill you later, we're going to bundle it all up and bill you later, and then you have to make that payment every month, and then it goes up and up and up every month. My suggestion, if you do have questions about how it operates and everything, give our office a call, and we can walk through looking at your specific scenario. Some members, we see no change in their cost. If they get in this program, they're just paying the bill to somebody else. But it was a response, I think, to patients who may have that deductible and maybe don't have, they were looking at it prior to having the $2,000 or $2,100 max out of pocket in place. So it solves some problems that don't exist for us at this moment. And here's kind of just a list of everything that we just talked about. Enroll in Medicare A and B regardless of employment 3 months to the 65th birthday. Plan year resets 1/1 regardless of when you enroll. Low income subsidy helps you if income is low and you're having trouble affording things. LEP, Late enrollment penalty, make sure you attest to having coverage so you don't have to pay it. IRMA is if you make too much money and you have an extra bill in your account. That's what is accounting for that. Explanation of benefits, shows everything you got that month. Self-administered drugs is what I'd talk to about non-admission stays in the hospital. You can reach out to us for assistance with those. Coverage gap, it's gone. Catastrophic coverage, $0 cost to you. Vaccine coverage, some vaccines are covered on B, some are D. So it depends on which card you're going to show at the pharmacy. In one of my handouts back there, I have some of the more common drugs that we see vaccines administered, so you know which card when to show at the pharmacy. M3P program will not reduce cost. It's not mandatory, but it does offer some smoothing if you're in a situation where you could benefit from that. And if you have questions about your medications, cost, formulary, status, coverage, or you just want to talk with a pharmacist, you can call that number, it rings, and then a pharmacist picks up the phone. It says, what can we do for you today? You may be getting a call from us, from KYRX. We run reports every year as the formularies change, as drugs come off market, or if there's any reason that we think that you could be negatively impacted by pharmacy, we reach out to you and offer you, one, the information, make sure you got the letter, two, offer you guidance through making sure that you don't have gaps in therapy, making sure you can afford your coverage and everything like that. So, and that's my team over there on the right. We are there at that phone number and that email address to give us a call and discuss any of your medications, cost, coverage questions. I think we have one question from the crowd. She wanted to get my picture.
Get out of my frame. I just wanted to reiterate, so if you don't take Humana Part C, you cannot get D separately. Your D separately, it has to be with C.
You can't get my D.
Through UK.
Yeah, you can't get the Medicare Part D plan through UK separately.
So we just have to go shopping and get our own Part D separately, not
Correct.
through the UK
Correct.
plan. It has to be both C and D.
Yes, ma'am.
Okay, next question. All C and D that we're talking about here through UK, all for Kentucky and through UK. If I move to Florida, that's when I need to, for open enrollment to cancel and do a new plan, or what?
No, we support people all over the country. If you retire from UK and you have this Medicare Part D plan, this is effective in all 50 states.
Okay, what about C?
I believe C is, yes.
Same for Humana. You can be anywhere in the United States.
Okay.
If you leave the country, it's a different story. But being in the United States, you have coverage.
Okay,
Yeah,
so
both
out of
sides.
country, no, it's
Correct.
not covered.
Yes. Any other questions? I think I'm between you guys and lunch, so. All right. We'll hand it back over.
So I am Coleman Simpson. I'm another one of the retirement specialists, and I'm here for do any Q of A. Now I know we've already asked a lot of questions, but Travis and Dan are still on hand here. So if you have any questions about anything that we've covered so far today, retiring from UK, I know there were some questions on dental and vision benefits, being eligible to retire, anything involving health insurance, either before or after 65. Any questions you may have? Yes.
As to hire dates, if I started working here first in '94, say worked for a few years and then took time off to raise my daughter and then came back in 2013, is my hire date the second hire date?
So it depends. Largely it depends on what is classified as your regular service date. Generally, if you were hired in a regular position, had a separation of less than 1 year, and then returned to work in a regular position, typically that your regular service date would be the first hire date. But let's say, for example, you were hired here in '94, and then from January of '96 to February of 2000, or, 97, right? You had a separation date of more than 1 year, that second date would then be your hire date.
Thank you.
Any other questions?
Demita, do you go, Demita?
Not that I'm in a rush, but I am a little bit, but, do you have to wait until you 65 to give your 30-day notice, or can you give it like 30 days before you turn 65?
Typically, the 30-day notice takes effect when you turn 65. So if you were before 65, I would say you would have to give a 90. However, departments can waive that if they so choose. So if they're fine with you retiring on your 65th birthday and you only give a 30-day notice, that's still fine. I would recommend talking to us, and we can go over more of the specifics of the situation. Yes.
Thank you. Question on phased retirement. Can you do phased 80% 1 year, 70% the next year, and 50% the third year?
Yes. So the way that it works now, of course, phased retirement is a maximum of 3 years. How you set that up would be something you would discuss with your department. You can always go down, but you cannot go up. So for example, in your situation, 80, 70, 60, totally fine. But you can't do 80, 50, 60, because you can't go up, you can only go down. Normally what we would recommend is when you're, filling out your the form with your department, I would recommend that you stipulate there from January 1st of 2026 to December 31st of 2026, I will be 80%. From January 1st of 2027 to December 31st of January, or 2027, I'll be 70%, and so on.
So just to clarify, the form's filled out once and can cover a 3 year. You wouldn't fill out the form for the first year, fill out the form the second year, and fill out the form the third year.
So you can do both. You can do a full 3 year, and typically speaking, it is a little bit more advantageous for you to do so because you're locked into that contract for the duration, although you can choose to retire earlier than that if you will. If you want to do a year-by-year contract, you certainly can do that. Still a maximum of 3 years total, but you can do it on a year-by-year basis. The catch on that is, if at the end of that first year contract or the second year contract, your department decides they no longer want to continue phased, then unfortunately you would have to retire at that time. Okay.
I had 2 questions. First, a quick one, just to make sure I understand. Those were great presentations, by the way. When one enrolls in the Part C with Humana, that fee covers Part D also? Okay.
That is correct.
Yeah.
The fee for that Terry had shown during at the end of her slide for the Medicare Advantage plan, that does include both Medicare C and D costs. Now, Medicare Part B, of course, is a separate thing, but C and D are bundled into that $8, $82, depending on your hire date.
Right. And then the second question is about sort of the maximum out-of-pocket per year. It looks like with Part C, the Humana, the hospitalization and physician charges, it's about $3,000 a year max for a family. And then for the medications, it would be about $2,000. So is it fair to say that $5,000 roughly is what the worst case scenario is you'd be paying out of pocket, even
Generally
with a pretty
speaking,
bad
yes, that is
illness?
correct.
Are there, I'm sure there are exceptions if someone has to go to rehab for a long time or a nursing care, things like that. But just in general, for if someone were to, get cancer and require lots of admissions and treatments and whatnot, it would be $5,000 a year max. Okay.
Generally speaking, yes.
Great. Thank you.
Just to clarify for the audience, they do accumulate separately. So, if you meet your $3,000 out-of-pocket maximum with Humana, that does not apply to prescription or vice versa. They are separate. But, like I said, in the absolute worst case scenario, it's $5,000 total, but the amounts are separate, if that makes sense.
Just real quick, so, and the way Medicare works, they see things on an individual basis. So like you and your spouse would be considered separate. So you would have your own separate maximum out of pocket from your spouse. So they don't, equate like family or any of that. So it's all on an individual basis.
Any other questions? Okay. Well, thank you all for joining us here today. If you have any questions, our vendors are still here in the back, as well as us here in retirement. We'll be back here in this back table. We appreciate you coming all. We will be sending out an email sometime this week with a recording of this presentation for your own viewing. And then we'll also be including slides in there as well. And then finally, we will also be sending out a survey. So if you would, please fill out that survey. And regardless of whether you enrolled online or in person, we would appreciate if you filled out that survey. So everyone online, thank you very much. All right. And then for those of us here in person, we do have the winners from the MPM Group's Kroger giveaway. So we have Deborah Schweitzer, I believe, and Connie Mitchell. Congratulations. You are the winners of the Kroger gift card. So if you want to come up here to the front, I will be happy to give that to you. And otherwise, everyone, have a great day. Thank you for attending.